Greetings and a warm welcome to everyone in attendance. I'm Rimpa, your assigned moderator from Clirnet, and I extend my cordial greetings to all the delegates from across the country. We sincerely appreciate all the doctors who have taken the time to attend the session with us today. Allow me a moment to introduce our platform Clirnet. It is India's most trusted live digital CME platform which allows doctors to create their own medical content. And I would like to take this opportunity to welcome the Master Doctor here today, also an eminent Dr. Amita Banerjee, sir. Dr. Banerjee is a professor emeritus in the Department of Community Medicine at D.Y. Patil Medical College, Pune, a distinguished epidemiologist and public health expert. He has decades of experience in medical education, field research, and preventive medicine. Known for his contribution to epidemiology, infectious disease control, and public health policy, Dr. Banerjee continues to guide student researchers and practitioners through his academic leadership and evidence based approach to community health. Thus, we are honored to have such a renowned expert with us today to share his insight on the topic nutritional status and health outcome in vegetarian, vegan, and non vegetarian diets. So, now without further any delay, over to you, sir. Thank you so much.
Thank you, Rimpa, and it's always a pleasure to come on Clirnet platform and greetings to all the viewers. So today I would be discussing or will be discussing something very vexing and very uncertain field in public health, that is nutritional epidemiology. There are continuous flip-flops. Sometimes fat is good, sometimes fat is bad, sometimes sugar is bad, and there are different diversity in diets across the globe and in our country, across the country, and there are great diversity in individual responses also, because many factors contribute to the outcome of a particular diet. It can be genetic, it can be environmental, it can be other priming during intrauterine life or during early childhood. So there are many factors. So nutritional epidemiology is full of pitfalls. So against this background, today we'll be discussing the different consensus, a brief review of literature. Actually, I have gone through, I will briefly give the review of literature. The literature is very vast and sometimes confusing. So a brief review of literature I will be presenting on the different types of dietary habits, and I'll be sharing some slides. I'll just get the slide share activated. Yeah, Rimpa, can you see the slides? Yeah. So this is the topic, nutritional status and health outcome in vegetarian, vegan, and non-vegetarian. And these would be the talking points, identifying the main differences. First, we have to define what is vegetarian, what is vegan, what is non-veg, because there are different versions of vegetarianism. Identify the purported benefits and limitations of the different diets. There is no complete gold standard. Different people respond to different diets. Metabolic and molecular mechanisms for these outcomes, and overview of existing evidence of the pros and cons of these dietary choices. There are trade-offs in each diet, and the conclusions and the way forward. So vegan is 100% plant-based. They do not even take any animal products like milk or eggs or fish. So vegans are totally plant-based. Then we have got vegetarian, different varieties of vegetarianism. One is lacto-ovo. That means mostly they take plant-based, but they take dairy products like milk, cheese, eggs. This is the most common, I think, in our country. And then they are pisco-vegetarian or fish eaters, like they are plant-based, but they can take, particularly people staying in coastal areas, they take fish and seafood, and some may take with eggs or without eggs and dairy. So this is also partly non-vegetarian, and all vegetarian diets exclude meat, that is beef, pork, lamb, venison, that is deer meat, chicken, and other fowls. I think bigger animals are excluded. Some vegetarian take fish, which is actually non-vegetarian, but they are river. And what are the purported benefits of different diets? According to American and Canadian associations, and according to our NIN also, we'll be presenting the NIN recommendation at the end. Appropriately planned and supplemented vegetarian and lacto-vegetarian diets are nutritionally adequate, suitable for individuals in all ages of the life cycle, and may provide health benefits in disease prevention and treatment. So vegetarian diet has a slight advantage. That's what they mean to say, provided they are taking the dairy products also and eggs perhaps. These statements are supported mainly by cross-sectional and prospective studies with accumulating data from a limited number of randomized trials. As we all know, the randomized trials are the gold standard. So we have got observational studies, and particularly in nutritional epidemiology, the observational studies have got a lot of pitfalls because there are various cofactors, other factors, racial factors, climate, way of living, exercise. But that's why the randomized trial are very difficult and very expensive. So we have got limited number of randomized trials in nutrition epidemiology, but the evidence is gradually accumulating. And what are the likely disadvantages of vegetarian diets? It is not that a vegetarian has got overall advantage. A vegetarian may be on paper, he or she may be a vegetarian, but they are likely nowadays with the promotion of fast foods, refined sugars, refined cereals like maida, sugar, and highly sugary drinks, fruit juices, and so they may be taking those things and it may become very unhealthy. So vegetarian diets have to be well defined. As a doctor, we should ask the patient ki you are a vegetarian, but what are your overall diet? Whether you take maida, whether you take sugar, how much sugar, those are more harmful than any benefit a person may get from a vegetarian or vegan diet. So unfortunately, in our country, we all know vegetarian diets are very rich in carbohydrates and particularly refined flours like maida. Particularly, we have got number of festivals and lot of sugar consumption is very high. And genetically also we are handicapped. As Indians, we tend to put on the central obesity. So we are vulnerable genetically, and even as a vegetarian, we may be not getting the full advantage of a vegetarian diet. Whatever is the purported benefits of the vegetarian diet, if we do not practice healthy vegetarianism or mindful vegetarianism. So refined flours, hydrogenated oils like dalda, trans fat, high fructose corn syrups, sucrose, artificial sweeteners, salt, and preservatives have been shown to increase morbidity and mortality. So whatever benefits are there in the vegetarian diets are offset by such unhealthy practices, which is very common in Indian society. So these are the left side is a healthy vegetarian and right side is a unhealthy vegetarian. So unhealthy vegetarian is all, as I said, it can lead to hyper this refined carbohydrates, high fructose, and healthy vegetarian is the complex fibers and whole grains and polyunsaturated fatty acids, monounsaturated fatty acids, potassium, magnesium, selenium foods. So these reduce your insulin resistance. These reduce your blood pressure. This has got cardiovascular benefits, cholesterol lowering. It reduces oxidative stress that is coming up in a big way, particularly amount of vegetables and plants, fresh fruits and vegetables. They are antioxidants. So it reduces inflammation, oxidative stress, and many chronic diseases, and brings down the insulin resistance, reduces diabetes, need for diabetic drugs, and cardiovascular. And on the other hand, right side also is a vegetarian diet, but it is having refined carbohydrates, it is having high fructose, saturated fat, and salt and artificial sweetener. So it causes all types of issues like hyperglycemia, insulin resistance, overweight, obesity is a big problem now. And central obesity, particularly Indians are genetically handicapped, hypertension, and it increases all mortality, all cause mortality and cardiovascular mortality. So vegetarian is not black and white. There are different shades of vegetarianism. So we have to identify healthy vegetarianism. What are the metabolic and molecular mechanism of benefit of vegan or vegetarian diet? Many factors have been hypothesized to play a role. Lipid lowering effects, we know. Glucose lowering, insulin sensitivity, and hormonal effects. Protection against oxidative stress, particularly fresh fruits, vegetables, and hypertension. Production of microbiome is coming up in a big way. Microbiome, metabolic and immune health. This is a work in progress, but there are evidence to show that a diverse diet in vegetarian, particularly fermented or dahi, curd, and other things, they maintain the gut bacteria and a healthy microbiome. So it's still, the science is emerging. So these are the metabolic mechanism. I suppose saturated trans fats, healthy plant-based diets, dietary fiber, high amount of dietary fiber, then energy density less, central obesity. It has an impact on central obesity. If you have a plant-based diet, you have got less dense calories, and vitamin C, E. These are the antioxidatives, magnesium and other trace elements you get, and cancer and insulin resistance is there, and all this. These are what we have discussed in the previous slide. It's in a diagram. So all these have a healthy vegetarian diet, coronary artery disease, heart failure, vascular disease, ischemic stroke, vascular dementia. It has a protective effect. This is the hypothesis, and this is the mechanism. Like overall, lowering the blood pressure, insulin resistance, taking care of insulin resistance, obesity. We don't put on weight on a healthy vegetarian diet like we put on a non-vegetarian diet. So all there's an indirect effect on the chronic diseases. But there can be, one has to have a word of caution also. There is a particularly for non-vegetarian, there is a big fad now. Take protein drinks, protein mixtures, and high protein, high protein. So results from both population and randomized diet anyway show that high protein intake, especially of a branch chain amino acids, associated with the increased prevalence and risk of developing pre-diabetes and T2 diabetes, type 2 diabetes. This was a surprise to me also. I have given the reference. So otherwise we thought we can take protein like anything. If we don't take like sugar, we cut down and we increase protein. Protein is important, and you have to see the individual patient. Some patients may require protein from convalescence, disease recovery, or elderly people may have sarcopenia. So with exercise, so cannot have a blanket recommendation. You take protein across the board besides the load on the kidney and other. They have been very high protein against the recommended like 60 to 70 gram per day for an adult, depending on the weight, per 1 gram per kg. Beyond that, too much beyond that is associated with pre-diabetes. I mean, this was surprising to me also. So any extreme in nutrition, one has to be cautious. So now present day fad is a high protein across all age groups. So we have to see this literature also. Then evidence from prospective studies have suggested that consuming vegetarianism may have protective effects against, we have discussed this, obesity, diabetes, hypertension, several types of cancers, but we still require more robust studies. Cognitive decline also, Alzheimer's. Whether these associations are causal, these are careful available, including data from other types of studies. So mostly these are observational studies which may have the limitations, but this is a work in progress. But by and large, the benefit is slightly tilting towards the vegan and vegetarian diet. Of course, if it is healthy. Otherwise, most vegetarian, as I mentioned earlier, go for this highly refined carbohydrates. Potential health risks are also there, vegan and vegetarian, accumulating that some vegetarians, especially vegans, who are consuming restrictive diets are greater risk of developing hemorrhagic stroke, bone fractures, and range of vitamin and mineral deficiencies that are particularly dangerous for growing children and pregnant breastfeeding women because they are not taking any milk products also. So they are maybe deprived of calcium. They may be deprived of essential vitamins. They may be deprived of vitamin B12, which have got only animal source. There is no, because vegans, they only take plant source. So vitamin B12 is deficient. There is no source of vitamin B12 for iron. There may be other micronutrients because their diets are very restrictive. So if there is a common thinking is that dietary diversity, it gives you all the essential vitamins, minerals, and other nutrients. So that one has to take care of. Because of that, they get bone fracture because of, and particularly for growing children and pregnant women, they require calcium. So vegan, either you have to supplement, or you have to. B12 deficiency is a major problem not only in vegetarian vegans, even in non. It's much of a problem after vitamin D, B12. So people following strict vegan diets must take B12 supplement or consume food supplemented with B12, including B12 fortified nutritional yeast, or they may have this megaloblastic anemia, potentially irreversible form of neuropathy and impaired bone formation. B12 deficiency can be a one has to look for. You ask your patient diet vegan, so you have to specifically look for B12 source. The dietary history is so important nowadays. B12 in spirulum or other algae is not bioavailable and may even inhibit B12 metabolism, but vitamin B12 in duckweed is bioavailable. But I don't know whether it is a very common source of food item. But by and large, B12 is highly limited in vegan diets. Other deficiencies in vegan and vegetarian diets. Other from iron and zinc. The iron deficiency is a major problem in India. You know, more than 50%, 60% women, children are iron. Because the iron content may be there in green leafy vegetables and all we keep on teaching, but the iron absorption is inhibited on a vegetarian diet because of many oxalates and phytates in the vegetarian, the plant diet. So they inhibit the absorption of iron. So this is a major problem, and all types of measures are being tried, like fortified rice and all that, but they are not very well established whether they work or not. Important and vegan children, pregnant, breastfeeding women, and those with menorrhagia. So iron deficiency, zinc deficiency. Many plant foods contain iron and zinc. As I said, their availability is limited due to anti-nutrients such as phytates, tannins, lectins, and oxalates. Cooking, sprouting, fermenting, and processing plant foods, vitamin C can increase iron and zinc absorption. Vitamin C can improve the absorption. So vitamin C improve, but one has to keep in mind, one has to test for hemoglobin and other things. For iron deficiency anemia may require supplementation also. Otherwise, non-vegetarian diets have got this advantage. Meat and other flesh, they are a rich source of iron and other zinc and other. So this is one disadvantage, B12, iron and zinc, and calcium in vegans. Then dietary calcium deficiency in vegan and vegetarian. Uh, Dietary calcium deficiency coupled with protein restriction and excessive sodium intake can risk of bone fractures. In ethical vegans who do not consume healthy diets rich in calcium, protein, and regular exercise training, adequate sun exposure, vitamin D, it gives vitamin D sun exposure, and vitamin important to promote bone health and prevent fractures. Of course, vitamin D toxicity can occur because again there is a craze for vitamin D self-medication. So one has to warn patients not to overdo the vitamin D. It can cause toxicity. And What else? Indians are really at a disadvantage, whatever diet they take, particularly if the large number of young children and large number of pregnant women, if they do not get proper antenatal care, proper nutrition during the antenatal period, there is an intrauterine growth restriction, which and early child malnutrition. Both these can give rise to metabolic disorders in middle adult life, and these people are more prone to central obesity and insulin resistance. So we are already at a disadvantage. So a healthy diet, whether it is vegan, vegetarian or non-vegetarian, and the vegan and particularly vegan diet, if a pregnant woman is a vegan diet, we have to take care whether there should not be intrauterine growth retardation or early child malnutrition because of the limitation in calcium intake and other nutrients. Because if there is a calcium deficiency in childhood, those children later in life will develop the osteomalacia, and no amount of calcium supplementation can reverse the harm caused during childhood. Similarly, children in intrauterine life and early childhood, those who are malnourished, in later life, no amount of dietary, in fact, they are at a disadvantage if they eat more, particularly carbohydrates. And as it is, our Indian diets are very high in carbohydrates. Even unrefined carbohydrates, slightly skewed towards carbohydrates. More to 60 to 80% Indian calories in Indian diets are from carbohydrates. So this is something which is likely to give rise to central obesity and insulin resistance. So some balancing is required, and that is how the National Institute of Nutrition has recommended. So this is a healthy plate. It has recommended. You see the proportion is left side half, almost half of the plate is with fruits and vegetables. So all types of diet, whether it is non-vegetarian, vegan, or vegetarian, all should have this fruits. It is non-negotiable. That is vegetables 350 grams and 150 grams of fruits on top, and on cereals 40 grams. That would be the carbohydrate and all, and then nuts and 27 grams, fats and oils, 27 grams, and nuts. And this is the fish, eggs, and cereals. It is exchangeable depending whether a person is vegetarian or non-vegetarian. So on one corner is the 90 grams of either flesh, eggs, or if a person is vegetarian, pulses. Pulses contains the protein, but the plant protein like pulses or rice and wheat, they are not full proteins. I mean, they have got limiting amino acids. So they have to be combined together, and our diets combines the dal roti or dal and rice. So some amino acids are absent in pulses. Some amino acids are absent in cereals like rice, wheat, and other cereals. I think lysine and tryptophan. Lysine is deficient in cereals, and methionine is deficient in pulses, amino acid. But if you combine them, it becomes a first-class protein. So that compensates for lack of meat uh, in the vegetarian and vegan diet. And those who are uh, non-vegetarian, they can take meat or fish or eggs instead of pulses. So this is and nuts and other things are same for a healthy diet. So if you balance this diet, I mean, whether you are a vegetarian, whether you are a vegan or a non-vegetarian, you will have almost comparable health. There should be not too much of excess of any particular thing. So this is the balanced diet plate which has been recommended by Indian Council of Medical Research and National Institute of Nutrition, Hyderabad. So this is the source. And the milk is there on the right side. It can be curd also better, because curd gives you healthy microbiome, or milk gives you calcium. So milk, a glass of milk is there. So this is a healthy diet. And these are the consumption, these are the summary by NIN. Consumption of correct proportion in the plate prevents macronutrient and micronutrient malnutrition, hidden hunger. The proportion indicated in the plate ensures adequate intake of micronutrients, vitamin, minerals. No vitamin or mineral supplement, no supplement is indicated. As I said, people have a tendency where whatever is the fad, now the fad is take vitamin D. Vitamin D can accumulate. Particularly fat-soluble vitamin A and D, one should be careful. No self-medication, because they accumulate. Routine consumption of certain nutrients will interfere with absorption of other nutrients. So if you take supplements, they may interfere with your natural nutrients, which may have more beneficial things which we may yet be not aware of. Microfood are better absorbed and more bioavailable. From natural sources, they are better absorbed than vitamin or supplements, capsules or fortification. Those are marketing, except for those who are vegan and other things, if you find the dietary sources not containing those essential elements. Complete diet indicated in the model plate provides many unknown substances which may still be unaware of. That's why it is better to take the fruits and vegetables rather than the supplement. And fortified food will not have those unknown beneficial factors. Then regular and proportion as per model plate improves immunity and resistance to infections. Maintain good microbial flora, beneficial bacteria in the intestine. Prevents diabetes mellitus, cardiovascular disease, and heart attack, strokes. And this is the main problem. We are going to become the diabetics capital of the world. Of not, we are going to be the most obese people. And there is a high pressure marketing of anti-obesity drugs that will only give the external loss of weight, or it may just reduce the gastric emptying or satiety center in medulla. But that same thing can be done with the diet as shown in the ICMR recommendation. If you have 50% of your plate is full of vegetables and fruits, that will give adequate satiety. It would give the antioxidants, it would give the other minerals, and it will prevent against obesity. Whereas ultra-processed foods are very concentrates, which will not have a filling effect. It will make you hunger more, your taste buds and your brain. There is a spike of sugar, you get a kick, and then again, because of the glycemic index, high glycemic index sugar, again it falls down, again you feel the craving. Whereas if you take a balanced diet as shown, you you don't get those pangs of hunger, pangs of craving. And particularly from childhood, it is very important. And that is the, if we fail to promote this healthy plate, we will fall prey to the market forces of anti-obesity drugs, which may be required definitely in certain refractory cases. Nothing is a panacea for everything. Whether it is a healthy, there will be some proportion of cases who may require anti-obesity medicine, but by and large, the majority of the population should not go over the edge into the obesity crisis, which we are heading for very rapidly. And there prevents insulin resistance, assures adequate intake of fiber is very important for gut. That's anti-cancer also, and prevents constipation, prevents environmental pollution such as heavy metals, and working as a detoxifying diet. So this fibers and all, it cleanses your system. These are the table form. The same thing in the my plate. What it is showing the different amount, like cereals, including nutri cereals like millets and all. Now they are saying it is 240 grams. That is not refined cereals, but whole cereals. Then pulses 90 grams per day. Then milk 300 ml, vegetables 350 grams, and fruit 150 gram, nuts and seeds 30. Particularly, they say there's nuts like cashew nuts, peanuts, or walnuts. They are good. They have got antioxidants. They have got essential fatty acids. They are good for health. They are good for cardiac health and things. And fats and oils 27, and the total calorie is 1187. Human requirement for a working, because most of them are sedentary, so elderly, but for a working, the total calorie requirement would be around 2000 kilocalories per day. So these are from the different, so, and total, the third year, it is coming up to 2000. It is for day, it is full day, it is 800 cereals. This is one plate, a whole day. Third column adds up to 2000. So these are some of the, yeah, these are tables you can see. It is available from the net. I have downloaded from the net. So if you want to see in detail, you can see, because this may not be very convenient to see on the presentation. These are some of the references. I have marked the reference number 3 in red, because this reference is a very good and detailed systematic review of all the studies, and most of the slides I have made from this. So this you can see at a leisure. It has a very detailed analysis, review article, systematic analysis. It gives what are the available evidence and what are the gaps in evidence and what are the future directions. So I think I have finished. So I think I can stop sharing.